There are so many health and wellness myths that we have to leave behind in 2026. As a doctor myself who loves health and wellness content, I see so much misinformation floating around in comment sections and in real life. The first one is that hormone therapy for postmenopausal women is inherently dangerous. Now, it truly is a complicated topic that requires a much longer discussion, but the early evidence that showed that combined estrogen and progesterone replacement increased the risk for breast cancer did show an overall very small increase. Think 8 to 9 extra cases of breast cancer for every 10,000 people they looked at. And there's good evidence that newer forms of progesterone are much safer. The concerns with estrogen and clot risk seem to be much less when people don't use oral estrogen and instead use topical. And there is very good data that when women are started on hormone replacement therapy less than 60 years old, there's actually a significant overall mortality benefit, even with those slight increases in potential risk. Hormone therapy can be excellent not only for symptom control, overall quality of life, but it is great for bone health and does seem to have some potential cardiac benefit, keeping in mind that heart disease is still the major killer of women. Of course, it's not always the right answer for everyone, but in well-screened patients who are getting it prescribed by experienced and knowledgeable providers, it can be a great option for many people. Number 2 is that protein is bad for your kidneys. I know that sounds wild when I see it, but I see it in comment sections and have met people in real life that say they eat low protein diets to protect their kidney. Now, there are medically cases of people with end-stage kidney disease where we do recommend decreasing their protein intake because it seems like that might help reduce the progression of their kidney disease. But it is not that protein itself is harmful on kidneys. Eating a high protein diet is actually one of the best things you can do for your overall health and wellness to help reduce carbohydrate, fat intake, and just because we recommend something for someone with serious organ dysfunction doesn't mean it's something that other people should be doing. Number 3, while we're on the topic of kidneys, is that salt is bad for you. We need salt electrolytes to survive. Now, again, there are some cases of people with significant organ dysfunction where it can help them to reduce their overall salt intake. But for an otherwise healthy adult, there is no reason to be severely limiting your salt intake. We need it to perform athletically. We need it to keep up our blood pressure. Also, salt is one of the major drivers of our hunger signals and fullness signals. So most people will continue to eat lower salt foods and just eat more of them to get the total amount of salt in their diet. And often when we reduce the salt in foods, we have to increase the sugar, the fat, and other things that we like to eat to make up for that sensation. And it drives me crazy that I still see people online talking about how they eat healthy and eat less salt. And even worse is the people that try to eat less salt and then take an electrolyte supplement. It's best just to always get the salt you need from diet, and you do not need to be significantly restricting it. Now, you can always, of course, take too much,